I decided to become a doctor because I've always been interested in science and working with people, and it seemed like the best fit for me after doing some clinical research when I was an undergrad at the University of Pennsylvania. My specialty is internal medicine and pediatrics, and we're double board certified in both internal medicine and pediatrics. The reason I chose that as my specialty is I have an interest in what we refer to as transitional care, or helping children with complex medical conditions transition from the pediatrics world into the internal medicine world as adults. One example of the patients that I would be taking care of would be pediatric patients with cystic fibrosis as they transition from the pediatric world into the internal medicine adult care world. I chose the Iowa Clinic as my practice location because they are dedicated to the patients that they care for, dedicated to providing the patients the best experience they can offer, as well as dedicated to the community that they serve. If I weren't a physician, I would probably be an airline pilot because I've always been fascinated by air travel and flying, and someday I do plan to get my pilot's license. The most rewarding part of my job is opening the door and seeing the smile on the patient's face as I enter the room, knowing that I'm there to take care of them. Something about me that might surprise people is that I can actually speak Swedish, and I took Swedish for 3 years in undergrad. Not the most useful language to learn, but I do have many extended family in Sweden, and so that's why I chose to study that. If I had to describe myself in one word, that word would be dedicated. I'm dedicated to my family, dedicated to my patients, and dedicated to making every patient experience fun. When I'm not at work, I enjoy spending time outdoors. So I live on 15 acres, and I enjoy doing yard work, working out in the woods, hiking, camping. I also enjoy cooking and trying new foods and/or restaurants. But most importantly is spending time with my family, and that's one of the main reasons I moved back to Central Iowa. The last book that I read is How Doctors Think. It was recommended to me by the chairman of pediatrics in my residency program, and it's a book about how patients and doctors can have the best and most effective relationships. Am I an Iowa when I was born Iowa State fan? That is a really tough question. I was raised a Cyclone, but then spent 4 years in medical school at the University of Iowa. So at this point, I would have to say that I cheer for the Hawkeyes. 3 things you'd find in my refrigerator right now would be bacon, because you can't have a good old Iowa breakfast without some bacon. Cheese of all varieties, because I love all things cheese. And I would have to say OJ because I love orange juice. I have to have at least 1 glass a day to survive.